at three-dimensional images like this. And insert a
Hello, everybody. Hello, Dr. Florian. How are you?
Fine, and you?
We are live.
So,
hello, everybody. I'm
we're
Mario
live?
Niadis. Yes, we are.
What do we like?
Well, we are live because it was 8:30, 11:30 in Rio de Janeiro. I started the broadcast with a studio music here. Now we are cutting the music and getting in. We'd like to excuse everybody because we are a little late and we are going to get a little later, yes, for the procedure. Today we have a very special show for the ones who are just getting in now. I'm Mario Niadis and I've got with me Dr. Florian Kongoli. And today, tell us where you are, Dr. Florian.
We are in Osaka, Japan, so we are starting live without being prepared. So
Yes.
we are in Osaka, Japan, at the Dr. Hori, one of the specialists in a revolutionary technique in cancer treatment.
Okay.
Our live broadcasting today was forecasted at 11:30 Japanese Standard Time.
Yes,
But
exactly.
because Dr. Hori, it is in another, he had two procedures, anti-cancer procedures today. The first one was in. Do you see me? It is okay. The sound is okay.
The sound is perfect, Dr. Florian.
The sound is okay.
Perfect.
So the first procedure of Dr. Hori was at 9 a.m. Japanese Standard Time.
Okay.
It is a procedure against ovarian cancer, and since this is a little bit difficult, Dr. Hori is still doing the first procedure.
Okay.
Our procedure was planned at 11:30, but still, it is in medicine, it's always he has to finish the ovarian cancer procedure first, and then he'll have about half an hour break. So the idea is that now we show a little bit the clinic.
Beautiful.
We go around. I am
Excellent.
here with Cecilia, which is assistant of Dr.
Say hello
Hori.
to her. I don't think she can hear me. So hello,
She
Cecilia.
doesn't hear
Can you hear me,
So,
Cecilia?
no, I have to give her. I have to have her one of my earpieces in order to.
No, just say hi to her. It's a pleasure to have her with us.
You see, the Mario, the camera here, it is looking backwards, not toward me.
Yeah, now I'm facing you.
Yeah, but okay. So this is Cecilia.
Hello, this is Cecilia.
Oh, this is Cecilia. Okay.
Yeah, she's
So
the
hello,
assistant.
Cecilia. How are you?
She's assistant of Dr. Hori, and
Okay.
we are at the Dr. Hori private clinic, and he's and this is his office. The view is beautiful because he sees from the ocean, from the sea. So we'll take this opportunity since we mentioned that we will have the live broadcasting at 11:30. Cecilia
Okay.
will show us around the clinic, and we'll
Okay.
go up one floor up to see Dr. Hori is still on the procedure on the ovarian cancer. So we'll have a little bit of a short overview, and then
Okay.
we're gonna go after together,
Mhm.
follow in real time the real procedure at
Very good.
around in about an hour from now. Again, it was supposed to be 11:30, but still the previous procedure went a little bit more in length because it's ovarian
Yeah, this
cancer.
is a different. This is even something different than anything we've done before, and I don't think anyone has ever done it before. We're going to experience a revolutionary cancer
Yes,
treatment
it's a revolutionary technique, and we are
Uh-huh.
broadcasting live for the
for the
first
first
time,
time,
I
probably in
guess,
the
in the
world.
world, a revolutionary technique. So there are
Exactly.
two big things
Exactly.
here. So for the
Exactly.
moment, let's go with Cecilia. I am the only one
Very
with
good.
mask, but without mask here, but since I have to speak. But Cecilia will show around. This is the doctor's office, the doctor's Hori's office.
Okay.
We're gonna go a little bit around. Cecilia, you guide us.
Okay.
You can show us. You
I
hear
saw
Cecilia?
some. I saw some suitcases there. Are they
Is it
yours?
That's my success. My suitcase
Yes.
is for
Okay.
the
Always on the
son.
move,
Okay.
right?
Yes. Well, we drove here from Osaka. It's about 40 minutes drive. So
Oh,
this is the
very good.
ocean.
Very good.
This is the you can see it's a beautiful area for a clinic.
Like a month ago, you were in Japan. Did you go to the beach in Osaka? I remember you went to the
No,
beach.
I was in the beach in Shirahama, but this is in
Okay,
a different
okay,
part. Actually, this is in between Osaka and Shirahama, correct?
okay, okay. Very good.
So it's almost
You're in the
in
western
between.
part of Japan,
But
right?
this is not the same beach. This is not the same area. This is
Okay.
completely. This
You're
is
in the
a different
western
area.
part of Japan.
But you can see that yes. But this is beautiful. You can see.
Okay.
So we have a clinic, and all patient rooms have this view. Correct, Cecilia?
Wow.
So but well, I don't want to go to the procedure before, but procedure is completely different. When you are treated for a normal, for a cancer, the normal traditional means, even to have a, Cynthia, come here, please. You can come here. So to have only a chemotherapy, you have to go to the hospital and you can stay long, and depending on the treatment, etc., etc. Here, it is only 2 days stay in the clinic because there is no operation. It's a procedure. It's a completely different. It's a revolutionary technique. We're going to explain how it works and so on. So that's correct what I'm saying. Correct me if I'm wrong.
Yeah.
And so
Dr.
yes,
Florian,
yes,
I've watched a special report from, let me see, by NHK.
yes, exactly. NHK did a report some times
Three-dimensional
ago.
And
images like
I've
this.
separated like 1 minute of it when about this procedure, just a graphic that is interesting. Whenever you want, we can show now. We can
Yeah.
insert
Well, we have
just
to.
1 minute. I separated 1
Well,
minute.
yeah, but we have to take the permission
Okay.
of the NHK, correct?
Yes, yes.
So we're not supposed to. So we
Okay.
can. But this we'll have time after that.
Okay, very
But
good.
for the moment, we go a little bit around. This is the administration office. There are 2 stores of the entire building, correct? 2 or 3 stores?
Three.
3 stores. There are 3 stores.
Okay.
The clinic is installed, covers the entire area. You see the beach here, and the client's room are facing all the beach. Probably, if you have a room, we can show one of the patient rooms with the beach.
Yeah, sure.
Yeah.
Later, and we can go to 5th floor and go to
Okay.
ward, and then we can show.
Yes. So for the moment, we're gonna show just a snap overview or where we
Okay.
are and what we are doing. So this is let's go probably in the 4th floor and see that you'll see that Dr. Hori is still doing the procedure.
Okay, very
Correct.
good.
Yes, yeah.
Yeah. So we're gonna take the elevator or the stairs. Hopefully, in the elevator, the signal will not cut off, but I
Okay.
think it will be okay. So we follow you, Cecilia.
Okay, this way.
So we are going now in the clinic in the fourth floor. So not the operation. So again, we are using the term operation in science. There is no operation. This is not a real operation.
Okay.
It's correct. So we are completely in a different world. So
It's an operation, not a surgery. Yes,
not a
like,
surgery. It's a
okay.
Yeah. Yes. So here, this is the description of technique, but we're going to go after this. The purpose of this is just to do an overview, and then we're going to go over to the technique. The real-time broadcasting of a revolutionary technique. So there are two first things here.
Very, very interesting. And we were talking about this. You are even in I was reading while I was prepping. Yes, and you were explaining to me like it's
Yes.
you insert a very small
Okay,
catheter.
it came back.
You can hear me?
Okay.
Yes.
So we were in the elevator. We are in the elevator. Here,
Okay.
here, Cecilia, we are in a
Yeah, are we going to the procedure room?
procedure.
Yeah.
So we are going to the procedure room. As I said, Dr. Hori is still doing the procedure against
Okay.
ovarian cancer. So
Very
he's still
good.
there. So that's why we are delayed with the real broadcasting. But these are the beauties of medicine. You cannot forecast how long the operation will take.
Okay.
Cecilia, this is the room where the operation is being done. We have two operations.
Okay.
There are two, no operation again, forget the operation. There are procedures. Non-surgical procedures.
Actually, it's very close in terms of inserting a stent, right?
It's very close, but the stent.
Very close.
The
Of course,
catheter
it's a
is
different technique, but
7 millimeter, 0.7
Yeah.
millimeter. It goes to the
0.7
blood
millimeters.
arteries, 0.7 millimeters. So
you
this is-
insert the catheter
yeah,
and you inject the chemotherapy, right?
exactly. We will explain.
I'm sorry, Dr. Hori, now using this report, and we probably will have to go other.
We go to the,
Yeah.
but they can show it. So we don't want we don't need to interrupt,
Yeah,
just to show.
yeah, okay.
So this is all the procedure is followed like it's electronically, it is followed electronically.
A lot of
At any
science, huh,
moment-
doctor?
And at any moment you show in the screen where is the catheter. Actually, the screen guides the doctor to continue with the catheter. This is revolutionary. So without the screen, without technique, you cannot do anything. And imagine this is that Dr. Hori has been developed this technique. 45 years of experience doing exactly the same, TACE operation, TACE procedure, not operation. We are used with operation. It's not surgical. It's not surgical.
Dr. Florian,
For the moment, we are
one
not,
thing that you always mention
Yes.
about SIPs is that now we're talking about medicine, but this would not be possible without engineering,
technology.
without science, without technology,
without
technology, innovation.
This is Dr. Hori. The clinic of Dr. Hori is image-guided therapy. Image-guided therapy. So he is specialist in images, and the images in real time guides him to continue with the catheter. So they are all it's followed in real time. There are two main rooms. There are many treatments here, but there are two main TACE operation rooms. We can show this. So this is how the rooms looks like. Yeah.
This is where the
So,
procedure takes place.
That's the procedure takes place. Everything is guided through here. You see at the same in real time where the catheter is in the body. So
Okay.
you didn't see it before because we cannot show the doctor now, but the doctor basically works like this and see the screen. You
I
put the
see.
catheter and see the screen. The screen, the guy is the doctor. So this is just an overview of the things. Actually, it's becoming more interesting because we're showing in advance.
Shouldn't you be wearing a mask?
Sorry?
Shouldn't you be wearing a mask?
Well, I don't have the mask. That's the problem. But because I'm speaking, should I have a mask?
なんかマスクした方がいいですか？大丈夫か
Yes.
な？
But it will be a little bit no, because
No,
this
but
is not
don't.
a real this is not a real procedure here. That's why we didn't go in the office there, because that is going on a real procedure. So that's why there I have to have a mask. But probably I can have a mask because of COVID anyway.
Yeah,
So
because
for
I
the
see
moment you
everybody
saw
wearing
it,
your now.
I know, but since I'm speaking, I have a mask here, and I'm gonna put.
Do you want a mask?
Yeah, absolutely. We can take it out.
Yeah, okay.
Let's go to the patient rooms and to see. But this is what what the beauty is this. It's non-surgical procedure, and how it
Okay.
works we're going to explain later during the live broadcasting. But probably now, as an overview, we can go see only the patient's room, correct?
That's outpatient clinic. Now we're going to outpatient clinic.
Outpatient clinic, because it's a clinic. Outpatient clinic is when you
Consultation.
consultation.
Medication.
Okay. So let's go there.
Okay. Which floor are you on right now?
We are on I'm on the fifth floor. Fifth floor
Fifth
is
floor.
the procedures room.
So you're going down now.
I'm not sure. Cecilia will guide us. We are in the outpatients floor, where people come and consult if they have a problem with cancer treatment,
Okay.
where other doctors have told people they cannot do anything, the cancer is untreatable,
Okay.
the chemotherapy was not successful, the radiation was not successful, that basically the other procedures, other doctors have gave up. They come here, and here they have a solution. It's not anymore the big beast of cancer that is unbeatable.
I
Here,
see.
yes.
This is the city.
This is the city room. So this is where
This is what? Sorry?
the CT scans. CT
Okay.
scans are Dr. Hori has a special it does CT scans of various patients, and you see the scans there,
Okay.
and you have a 3D um, scan of all organs of the body.
Mhm.
Yeah, you can explain, please.
Back to the pelvic floor.
From the back to from here to here, correct?
Yes.
Okay. And this is contrast enhanced CT
Yes.
CT scan. Contrast enhanced is it is you basically inject
The
in
contrast.
a contrast liquid, correct?
Yes, inject, and then we'll do the scan.
Yes. So the purpose of injecting the contrast liquid is that the scan is able to determine where this liquid it makes a contrast in all
Okay.
organs of the body in order to show where the tumor is, or if there is a tumor, if there are metastases, etc. It's a very special technique because there are several CT techniques, but this is contrast enhanced technique. So you inject a contrast liquid in the body, and the CT scan follows. And you can see that here, you can see all the organs through the CT scan, the previous one, I guess. And then there are other CT scans, but this is one of the, according to Dr. Hori, it is one of the best. He actually is the best technique that guides him to follow this procedure. Correct?
Very
Because
interesting.
there are PET scans, correct, where they inject sugar and find out if sugar accumulated around the tumor, around the tumor, because normally the tumor and cancers are they attract sugar.
Oh,
So
yeah?
cancer basically,
Interesting.
yes, cancer, the main food for the cancer is sugar. And PET scan, you inject PET scan in the body, you inject a type of scan in the body, a type of sugar container liquid in the body. And then
Okay.
if you see that there is a concentration of sugar in one place, that is the tumor. But this is a different technique. But
Okay.
Dr. Hori is so specialist that he can combine PET scan with contrast CT enhanced scan, and can combine them together, correct? And this is unique, because some doctors normally first there are so many unique things here. Okay, Normally in the hospitals, the doctors treating cancers are ignorant of the imagery. They know nothing about imaging. They are based only on the report. People do the scan, the doctors that deal with the scans see the scans and they write the report. And the doctor dealing with the cancer read the report only. They do not know anything. Well, they might know a little bit, but it's not their duty to see. So if the report is wrong, the doctor treating the cancer could act wrongly. And here is Dr. Hori's specialty. That's why the clinic is image-guided therapy. He is specialist in radiology, in CT scan, in PET scan. He can combine all this together electronically. And based on that, he gives you the diagnosis and he makes the procedures in real time. He put the catheter by being guided, and we're going to see it later in about an hour. So there are so many new things here. You know, it is incredible. So this is my understanding. If I say something wrong, you correct me. Correct? Am I correct? 100%?
Actually, yeah, and our doctor just make their diagnosis according to the CT scans.
Yeah.
And then later, and they will do the test procedures under another CT.
Yes.
And also another machine called IVR CT we use.
There's another IBR.
Yeah, and later maybe Dr. Hari can show us the machine is very unique and probably only in Japan, we are the first facility to have 3 IVR CTs. Yeah, the number one
CT is contrast intensity.
No, it's called IVR CT.
IVR. What is the principle of IVR?
Probably later we can ask him.
Okay. So there are 3 unique type of CT scans that Dr. Hori does, and they are the only one in Japan doing this.
Yeah.
So we are here very, on top of the top. And so, people should not be afraid of cancer anymore. They have a solution. So this is
Dr. Florian, when she
yes.
said IVR, what does IVR stand for?
Well, she suggested us to speak with Dr. Hori for the details, what is the principle of IVR. So we're going to speak it after later. So let's go. We are here just in a general overview. I do not know myself what is AVR, but apparently it's a very new technique that they only have. And they have 3, correct?
Yeah, we have 3 IVR CTs.
3 IVR CTs, which you are the only one.
Yeah, the only one in, I think in Japan, even the world.
In Japan, and most probably, she is not sure, but I'm sure it's in the world. So it's a totally different thing. We're going to see this later, but this is just an overview. We are using the time, since Dr. Hori is still under doing the procedure. You see, now we have to make use of the word procedure. It's not operation. It's not surgical procedure. It is a non-invasive procedure. So we should use when I say procedure, it's non-invasive. It's a catheter going inside. So I follow again what you can show us.
Okay, so later we will go outside to the outpatient clinic. I'm sorry, I will ask you how to put on a face mask.
Sure. We asked that. Yeah. So we had our mask, but we had in the car. So thank you. Now we are going to Cecilia will show us other rooms. You can show us. So this is the main hall when people are being welcome.
We're losing you a little bit, doctor.
This is our nurse station.
Nice to meet you. So this is. You see, you have still the beach and the sea in the background.
Yeah.
Okay.
Here, and then we have 7 consultation rooms here.
There are different consultation rooms.
And we also have a massage chair inside. And all
So they treat patients very good. So they all are massage chairs.
Wow, this is
This
good.
is the first visit when somebody comes here. And, you see,
yeah. And Kansai Airport is just in front of the Kansai Airport.
so you see in the background there, the island there is the Kansai Airport. Mario,
Yes,
are
I
you with
can
me?
hear you.
Okay.
Yes.
So when we drove here, by the way, we got the wrong exit and went to the Kansai Airport and then
Oh, I
returned.
see. So
Oh.
you got
we,
lost.
well, not, we just missed one of the exit, the last one, just one. Instead of that, we went to the airport and around maybe U-turn. So we went there and came back here. So we lost about 10 minutes. So this is the room. So these are outpatient clinic. It's called, correct?
Yes.
Yeah. So we can go. We can follow it. So these are massage chairs. So all the clients coming here while waiting, they have a massage chair.
Very good. Very interesting.
So
Amazing place, huh?
yeah. So we're gonna go. Cecilia will guide us to show us other.
Yeah.
Okay.
Waiting area.
This is the waiting area for different things. So all the way to have the sea in the background.
You're on the same floor you were originally, right?
Not in the procedure floor. We are in the fourth floor here.
Yeah, the procedure room is inside.
Okay, so we are in the fifth floor.
We are
Fifth floor.
on the fourth floor.
Fourth floor. Okay. Okay.
The procedure room is also on the fourth.
Okay, the procedure is and on the fifth floor. On the
Yeah, that's inside.
okay, and the third floor is the
The
offices, the administration offices,
yeah.
where we started.
The ward.
Okay. So these are
Yeah.
same, rooms, consultation rooms, and then you want to show us the fifth floor, correct?
Yes. We're going
Okay.
to the ward.
So this is very interesting here, but it went off. Let me see.
What's this, Dr. Florian?
Well, to show you that the operation is done through the screens. So the screens guide the operation. It's not the screen is not following the operation. Not the operation. Sorry again, it's not an operation. It is a procedure. It is non-surgical procedure. We are used with operation. Forget about the word of operation. It's non-destructive. So basically, the doctor, we're going to see it after, but there was a picture here. Now it's going. Doctor see the screen moving.
It's like a video game.
Like a video game, exactly. Like a video game. Here. So the screens are what went off. So because it's just pictures going around. But this is a screen that guides. It's not vice versa. It's not a screen that follows what you are doing. No.
I see.
The screen guided you to input the catheter inside and to up to the catheter reaches the tumor. So you have to be very precise, and this is only Dr. Hori can do that. And this is because you have to be so careful also not to damage the arteria. Because if you damage the arteria, then you have to do a real surgical procedure to fix it.
Of course.
But he is doing it. He's doing about 1,200 TACE. It's called TACE. TACE procedures per year.
Wow.
1,200 per year. And this is not only a Japanese.
That's like 4 per day. No, more.
That's
5 per day.
5 per day, yeah. So it depends on the day. For the day, for example, today is 2. To do it. It was at 9 o'clock. It's not finished yet, and then the other one. So, but this is the 45 years doing exactly the same thing. So basically, if I understood, this started with only with liver tumor and cancer metastasis. So it was so successful in liver and cancer metastasis, and now they are applying it in many others. So, for example, you saw here he was doing the ovarian cancer procedure today, So now it has gone to lungs, has gone to basically everywhere in all organs of the body.
Even
And
prostate.
again, we have to ask him. I didn't see the prostate in the list, but we have to ask him. Probably there is the key point is that, you know, you have to find where it is a tumor. We have to be able to, with the catheter, to reach the tumor, and then
Yes.
to
So
spray.
you need
and
a
to
big
inject.
artery around.
Exactly. Well, big artery, well, it depends. The catheter is 0.7 millimeter. Sorry, millimeter. So 0.7 millimeter. So you have to be able to reach you have first, through this catheter, you inject so-called chemotherapy against
Yes.
the so-called classical, but it is a drug.
But you need much less, right?
Much
Because
less,
you're
because
going,
you're gonna
yeah,
put the
it's
chemotherapy only in the
much more
tumor.
concentrate.
Much more concentrated. There is no side effects that chemotherapy causes all over the body. Forget about this. This is just concentrated. But this is only one part of this. So first, you have to be able to put the catheter and reach the tumor. That's the thing. Nobody does that, just Dr. Hori, and is developed by him. Second, you inject the so-called chemotherapy, but actually it is a chemical that kills the tumor. And then the third thing is you block the blood vessels that feed the tumor. And that's the 3 steps are being performed here. Yes.
Very, very interesting. Now, Dr. Florian,
12:30
you're now going.
12:30, and then we will go to Dr. Hori.
Okay. So now we are going to.
The word for fifth.
Okay, the 5th floor. Yeah. So here we might have a little bit of
Interference. Yeah, Dr. Florian's getting on the elevator. So as it normally happens when we do this, we get some connection issues. But as we were saying, he's going to. We're going to watch.
Okay, good.
Oh, you're back.
Because we are in the.
Okay, Dr. Florian.
Yeah. So we are in the 5th floor now. This is the name is patient ward.
Yeah, patient word.
Patient ward. So you can explain. Cecilia, I leave Cecilia to explain.
Okay. We have 3 big rooms, and every room there were 4 beds inside, and totally we have 19 beds.
19 beds.
Yeah, 19 beds, and each of our overseas patients, and they have to stay here only for 2 days. Yeah.
So this is the difference. You need only 2 days being hospitalized. Actually, it's not hospitalized. It's just to make sure that everything is okay.
Yeah.
It's not that they're undergoing.
Not necessary for long,
Exactly. So it's a 2 day.
The whole
just to make sure
treatment is
that
2
everything.
days, or only the
procedure is 2 hours. The procedure is 2 hours. They stay only 2 days just to make sure that everything is fine.
Yeah.
And
There's no
then?
need in any other procedure, correct?
Yeah.
It's just to make sure that everything is fine. So 2 hours
Wow.
procedure, 2 hours stay for a cancer, and you can see all the rooms. There is nobody there. All the rooms have a sea view, correct? There's nobody here. Oh, so we cannot enter if somebody for privacy.
Okay.
But this is the. Okay, there is an empty room. So, but this is real science at work.
Light up.
So this is So this is what the patients experience.
Wow, it's
this view.
this is like an infirmary, right?
Exactly. So this is the that's the Kansai airport in front. So this is and doesn't
Beautiful
look
place,
like a
huh?
hospital. Doesn't look at the hospital, but actually
No.
it is not.
That parking lot serves this building. It's
Sorry?
a big parking
Yeah.
lot.
Yes, the big parking lot for this building, correct? Yes. Yeah, but our car is parked there. Oh, no, on the other side. But this is, yeah, yeah.
Wow, it's
So,
huge. Huh?
yeah, yeah. So this is it doesn't look like a hospital because it's not an hospital. It is just to take care of the patient, just to make sure that everything is fine.
I see. Just to
So
monitor the patients.
just to monitor, probably might be any damage of the arteries or whatever, but just as a precaution. So you fight cancers in 2 hours. In 2 hours.
I'm amazed with this. I'm amazed with this. Now,
In two
Dr.
hours.
Florian,
So
let me tell you. You have to get ready for the procedure.
yeah, for the other ones. So we
I
have to have
think
a
I think we
10 minutes
should
break between
interrupt this
hours.
broadcast in order to.
So
Dr. Florian, we are experiencing some
Yeah.
connection issues. Dr. Florian,
the VIP room. いちごありますか？
so
すいません。
Dr. Florian.
Okay.
yes,
Yeah,
I hear you, but a little bit bumpy. You hear me?
Yeah, it's a little bit bumpy. That's
Is
what I
this
was going to
Wi-Fi?
say.
Probably.
Well, we are experiencing some connection issues with Dr. Florian. He's walking around, and meanwhile, while we keep looking at it, while we don't have Dr. Florian back, let's take a look at the presentation. Yes, that we have here from. Here it is. Yes, the clinic presentation. And here is Dr. Shinichi Hori. He's in a procedure now. And as soon as he finishes the procedure, there's going to be a break, and we're going to have a broadcast that for the first time they're going to broadcast live this procedure. Yes, a catheter is going to enter an artery and go directly through the tumor and inject directly in the tumor the chemotherapy, and also preparation, also a chemical that will cause like the clogging around the tumor, and so it will not have enough blood to feed the tumor to keep it alive, so it will shrink and die eventually. So this is a revolutionary technique, yes, that has been developed, and now we are watching it with Dr. Florian. And what we're going to do now is we're going to interrupt this broadcast, and we're going to be we're going to be back as soon as the doctor is available. Dr. Shinichi Hori is available for the procedure. So we might be back in an hour or maybe an hour and a half. So we're not going to schedule or set up a time here, because it's impossible to predict. But in an hour and a half, an hour give or take, we'll be back with Dr. Florian Kongoli and also Dr. Shinichi Hori, using this revolutionary procedure is that we are going to watch live here. Well, Dr. Florian is getting back.
Yes, I'm back. I'm back.
Yes, Dr. Florian, how are you?
I'm
I
back.
was just telling everybody that we're going to be back like in an hour, give or take. Yes, for the.
Well, no, we're here. So anyway, it was the last time, and in order we can because we have to follow the real procedure now.
Yeah, okay. but it's going to take around an hour at least, right?
Yeah, no, we have to start it actually now at 12:30 in about 15 minutes. He's gonna
Oh,
start the
yes.
second operation in 15 minutes.
Yes.
Yes. So we have to close here.
Okay, we're going to close and
we
we'll
have
be
to
back.
close
Oh, no,
here
it's
and
going to
then.
be sooner than I thought. I thought it would be in
But
an hour.
basically, yeah, because it took about an hour. It was so interesting. It took longer than we thought.
Ah,
We thought
okay,
to do it in
okay.
5 minutes.
Okay, very good.
So-
So we're going to end this broadcast, and very soon we're going to be back. So,
But basically, we did a tour of a clinic.
beautiful.
We
Beautiful.
didn't. The only thing we didn't see is the VIP room. We can go and see there, you know, and then we finalize there, because this is a magnificent room. You know, people that need, you know, to. You hear me?
Yes,
Hello?
yes.
Yes, because here we lost the signal at the time. So this is the VIP room. Look at this.
Okay.
This is a hotel or a hospital.
Wow.
So,
It's
you know,
it's a huge suite.
It's a huge suite, but this is for the outpatient. So in order to stay, you have a jacuzzi, you know, everything is glass, and you see the bridge that goes to the airport. So
Very
this is a
good.
VIP. So this is actually the best place to close this, because we're going to go to Dr. Hori for live
Very
broadcasting.
good. Very good, Dr. Florian. Well, stay tuned, because very soon, 15, 20 minutes at the most, we're going to be back with the procedure. Yes, with this
Correct.
arterial catheter, embolism. How do you call that?
Embolization, correct?
Embolization. That's it. Embolization. I have
Embolization? Embolization meaning is blocking, correct?
It blocks.
Blocking
Yes.
blocks the blood
it
vessels that
suffocates
feed the
tumor.
tumor.
It suffocates
Exactly.
the tumor.
Exactly.
Well, okay. So stay tuned, because we're going to be back. So if you're watching this on YouTube, remember to subscribe to the channel. Just hit the bell so that you're going to be notified when we're back live from Osaka, Japan. That's it. See you back soon. Bye-bye.
So I thank you, Cecilia.
Thank you, Cecilia. See
Thank
ya.
you. He's saying thank you, Cecilia, for
Okay.
this trip. And this is actually, it became much better because we have an overview first.
Oh,
Before going to the
excellent.
procedure.
It was
So
excellent.
thank you, Cecilia.
You're welcome.
Very
So
good.
we'll go to the
That's it, Dr.
procedure.
Florian. See you in a while.
Okay, see you.
Bye-bye.